Hello, my name is Caroline Howard. I'm the clinical pharmacist here at Carolina Advanced Health, and today I'm going to spend a few minutes talking with you about smoking cessation. In the first part of this series, we will talk about preparing to quit, and then in the second part, we will talk about medications that you can use. The tobacco use is the leading preventable cause of death. It accounts for 440,000 deaths in the United States and 6 million deaths worldwide every year. In addition, secondhand smoke is very dangerous and accounts for 50,000 deaths in the U.S. Considering this, it's not surprising that many smokers want to quit, but just figuring out how to quit can be difficult. Without getting help, trying to just do it on your own, only about 3 to 7% of people are successful in quitting. But by getting optimal treatment, which would include medications and counseling, you can increase your quit rate up to 30%. If you tried to quit in the past and haven't been successful, just remember that it can take an average of 10 attempts to quit successfully. So don't give up. You may just need to try a different strategy next time. The tobacco dependence, it involves a physiological dependence, which is related to nicotine. That's the drug in the cigarettes that will cause dependence. And if you stop it abruptly, you're going to experience withdrawal symptoms like irritability, anxiety, difficulty concentrating, and increased appetite. Besides the physiological aspect, there's a behavioral dependence as well, with just the habit of smoking, maybe something that you enjoy, something that you're used to doing, or have certain situations that you associate with it. So in order to be successful to quit, you really need a strategy that focuses on both things, which will, for most people, involve counseling and medication so that you can be most successful with your quit. I love this slide, which talks about the benefits of quitting, and you can see that some benefits occur really soon after you quit, and some take longer, but no matter what you're doing or where you're at in that process, you're getting benefits from quitting. So you can see that after 20 minutes, your blood pressure is coming down. After 12 hours, carbon monoxide levels drop to normal. In 2 weeks to 3 months, your circulation and your lung function improve by 30%. A year out, your risk of having coronary heart disease is reduced by 50%. 5 years after quitting, stroke risk is similar to someone who has never smoked. 10 years out, lung cancer risk is reduced by 50%. And 15 years out, your risk for coronary heart disease is similar to someone who has never smoked. So these are huge benefits. In addition to those, some things that you might, be more pertinent to your day-to-day life or things that you're worried about is, it could improve your health overall, but your food can taste better, improve your sense of smell. Think about the money you could save, and then think about your family and setting a good example for your children or your grandchildren. If you're going to have children, you definitely have healthier babies without tobacco, and you're going to feel better overall. So getting ready to quit, think about triggers and situations that may be difficult for you. So what's tripped you up in the past? Certain things, situations like drinking coffee, that drive to work, work breaks, maybe when you're bored or with friends. Think about those times when it's most difficult for you and start thinking of a strategy to help you cope with that. Additionally, I hear often that people use smoking to deal with stress, and they feel like it's really the only way that they can deal with their stress. But smokers often confuse the relief of withdrawal with feelings of relaxation. So go ahead and think about when you're quitting about what's going to be stressful for you and what you're going to do during that time. And just know that there's things you can do besides smoking. Many people are also concerned about weight gain, which can definitely occur with smoking cessation. You may gain about 10 pounds. However, the health benefits of quitting smoking far outweigh this. There's certain medications we could help pick to help you quit smoking that may minimize the weight gain. And additionally, I wouldn't recommend doing a strict diet during this time, since we want you to focus on really eating healthy while you're trying to quit smoking, but not trying to do a strict diet at the same time as you're quitting. Many people are also concerned about the withdrawal symptoms. So I'd like you to pay attention here that the symptoms occur in the first 1 to 2 days, and then they peak in the first week, and after 2 to 4 weeks they subside. So while these symptoms are real, they don't occur forever. And the cravings can last longer, and you just have to develop, work with your health team to develop strategies on how to deal with that. These next 2 slides, I'm not going to go over them, but you can pause the video if you'd like to take a closer look. But they discuss some of the withdrawal symptoms, such as craving for a cigarette, and how you might deal with them, which is wait out the urge, which lasts only a few minutes, and maybe find a way to distract yourself. And this next slide also has some other withdrawal symptoms. You're welcome to pause this slide and take a closer look as well. In conclusion, as you're thinking about tobacco cessation, discuss a plan with your provider. So let them know that you're interested in quitting, even if you're not quite ready yet. Let them know where you're at in that process. When you get ready to quit, think about setting up so that you can get counseling and medication so that you can be most successful. Setting a quit date is very important. So when you're ready to quit, go ahead and find a date and hold firm to that. And then get prepared. Are there medications that you need to pick up? Are there cigarettes laying around your house or in your car that you need to get rid of? Are there situations that you need to prepare for? Spend some time thinking through that so that you can be successful. And this slide has a few websites listed where you can find more information. Additionally, if you live in North Carolina, I'd like to draw you to the link for the Quit Line NC, which provides smoking cessation counseling. So stay tuned for part 2, where I will discuss more about tobacco cessation medications. Thank you.